My name's Sarah and I'm one of the infant feeding coordinators. How a mother holds and guides her baby can make a difference to their ability to breastfeed effectively. There are 5 key things you need to remember when holding your baby to help them attach well to the breast. These can be used regardless of what position you choose to hold your baby. The breast is accessible 360 degrees. You can use these principles to find what position works best for you and your baby. Baby needs to be held close so they can scoop enough breast tissue into their mouth. Hold the baby's body in close contact to your body. This helps them to feel secure and stable. If your baby's arm is in front of their body, this can stop them reaching the breast easily. By having baby's arms either side of the breast, it will help them stay in close body contact. Baby's head needs to be free so they can tip it back and approach the breast with their chin leading. Support their neck, shoulders and back so the baby feels secure and able to tip their head back easily. Your baby's head and body should be in a straight line facing the breast. This means that baby doesn't have to twist their neck, which would make feeding and swallowing more difficult. Imagine you were drinking a glass of water with your head turned towards your shoulder. It's very difficult to tip your head back and swallow in this position. It is important to line up your baby's nose with your nipple. Imagine my hands are your baby's mouth. Gently touch the nipple on baby's top lip. This will encourage them to open their mouth wide and tilt their head back with their chin coming onto the breast first, well away from the base of the nipple. The nipple will automatically point to the roof and back of baby's mouth. The top lip will brush over the nipple, drawing it into the empty space at the back of baby's mouth. As the baby suckles, they get big squirts of milk and feeding is comfortable for you. If the baby starts off with the mouth opposite the nipple, they don't have to open their mouth as wide. As they come onto the nipple, they squash the nipple between the tongue and the roof of the mouth. This causes soreness for mum and the amount of milk baby gets will be much less. If you start off with the nose opposite the nipple, hopefully the feed will be comfortable for you and the baby will be content whilst they feed. It's important whilst you're feeding to be comfortable to be able to maintain the breastfeed. You can use pillows or cushions to help support you once your baby is attached. Leaning back during the feed can help you and your baby maintain your position and can make the feeding more comfortable for you. You can begin the feed leaning back with a cushion in the small of your back for support. Your baby has a large mouthful of breast. Your baby's chin is firmly touching your breast. It doesn't hurt when your baby feeds, although the first few sucks may feel strong. If you can see the dark skin around your nipple, you should see more of the dark skin above your baby's top lip than below your baby's bottom lip. Your baby's cheeks stay rounded during sucking. Your baby rhythmically takes long sucks and swallows. It is normal for your baby to pause from time to time. Your baby finishes the feed and comes off the breast on his or her own. The nipple is rounded when the baby comes away from the breast. Baby should be calm and settled throughout the feed. Another sign that your baby is getting enough milk is how many wet and dirty nappies they're having in 24 hours. They should have at least 5 to 6 heavy wet nappies, and after day 5, babies should pass at least 2 to 3 soft yellow runny poos, the size of a £2 coin or more. After 6 weeks of age, when breastfeeding is more established, this may change with some babies going a few days or more without having a poo.
If you have any concerns about your baby's feeding, contact your midwife or health visitor who will be able to support you.